Hi, I'm Dr. Sian Cole, and today I'm doing a video on the psychology triangle. So this is to help people understand what things psychologists actually do and how to prepare yourself for seeing a psychologist and what kind of things to discuss and actually how we help. So I've explained to people many times about what psychologists do, and I kind of discuss about how we help people with their thoughts, their emotions or feelings, and what they do, their behaviors. So I thought I'd do a little video to kind of explain what each of those things actually are and how we might actually help somebody with their problem. So today's example, I'm going to talk about having a needle phobia. A very common phobia and something that I see a lot as a health psychologist. So when somebody comes to a psychologist with a problem, and it could be a relationship breakdown or a cancer diagnosis or losing confidence at work or whatever it is, psychologists are going to be asking people about how this problem affects their emotions, their behaviors, and their thoughts. So, for example, when somebody has a needle phobia, they're going to have a lot of emotions. Now, you can talk about emotions, feelings, sensations. I'm just using emotions as the kind of general term there. So I'm going to see things like, or ask people about what their emotions are. And they're going to say things like anxiety. They might break that down into the sensations that anxiety occurs for them, such as like a tight chest or difficult breathing. They might start to feel dizzy. I've had some patients who faint when they have needle phobias and a needle is coming at them. Might have heart palpitations, feeling sick in the stomach. A lot of that fight, flight response that we get when we have a threat. So that's where that would be under emotions. So obviously a lot of the behaviors or actions that we see in people who have a needle phobia is that they're going to avoid needles. So some patients will avoid seeing their doctor or even going to hospital or even visiting a friend in a hospital just in case they might see a needle out on a trolley or another patient receiving a needle. So avoidance is a really common behavior that psychologists definitely help, because sometimes you can't avoid actually having a needle and you can actually end up being very unwell because you've tried to avoid going to the doctors. So thoughts definitely come up in regards to helping manage people to deal with actually having a needle phobia. So some thoughts that people have in the example would be, I will faint and make a fool of myself in public, or the pain will be excruciating, terrible, I won't be able to cope with the pain, needles hurt, or it might be about the blood makes me feel sick. So the thing is, these three things all interact. So what we do as psychologists is actually teach people how to manage their thoughts, how to make room for their emotions. So most importantly is that they can choose the behaviors they want to. So sometimes people get confused between thoughts and feelings, and sometimes our language can really do that. It's like, I feel unheard, which actually you're thinking that you're not being heard and you're feeling annoyed. So emotions, feelings tend to always be one word: sad, angry, upset, scared, love. Where thoughts are going to be I am, I will. They're going to be more wordy, really. Thoughts can also be memories, images as well, stories. Sometimes thoughts can be very, like even movie length, or they feel like that, very in-depth stories that our minds give us. So, psychologists can actually help people to manage these three things so people can deal with the problem.